Hello everybody, I am Dr. Ghodeswar, Senior Cardiologist. On occasion of World Heart Day, I am talking on heart attack prevention and treatment. Risk factor for coronary artery disease is modifiable risk factors and non-modifiable risk factors. Modifiable risk factors are hyperlipidemia, smoking, diabetes, hypertension, physical inactivity, overweight obesity, and diet high in carbohydrates and fat. Non-modifiable risk factors are age, sex, family, and personal history of coronary artery disease. Atherosclerosis is a disease of coronary arteries and where the cholesterol or the lipid is deposited in inner wall of coronary artery, and subsequently this cholesterol is built up gradually and the plaque is formed. When this plaque became a complicated or the ulcerated where the thrombus is formed and coronary artery is blocked, it leads to the oxygen and blood supply is deprived to the heart and heart muscle get damaged and they become dead. Subsequently, this leads to the heart attack. So to how to investigate these patients? The investigations for coronary artery disease or the heart attacks are ECG, two-dimensional echocardiography, treadmill stress test, and coronary angiography. Coronary angiography is indicated in patients with acute myocardial infarction, acute coronary syndrome, and patients with severe angina. If treadmill stress test is strongly positive, then coronary angiography is indicated. And if echocardiography and ECG is suggestive of some significant coronary artery blockage or some severe ischemia, then these patients should be taken up for directly for the coronary angiography. This is a patient, 50 years old male patient, came to us with ischemic heart disease with anterior wall MI with cardiogenic shock. We did his coronary angiography in emergency and it revealed left main LAD and L6 stenosis. We did the angioplasty with stenting to left main LAD and LCX. However, it was very high risk angioplasty, but everything went all right. Hospital stay was uneventful and this patient was discharged in stable condition. These are the blocks which was seen in the pre-PTCA and subsequently it has been well opened with angioplasty with stenting to this patient. So why we should worry about the heart attack? Because the heart attack is very common. It is leading cause of death all over the world. It is the major reason for the morbidity and mortality in India, in developing countries and in developed countries also. It causes the disability. If the patient has a severe alveolar dysfunction or some mechanical complication because of the heart attack, it causes the physical disability and patient may not be able to do his normal physical activity or his professional duties. That's why it's very important. It is a deadly. In few patients, the heart attack it's one of the reason for the death, or it's if the heart attack get complicated with the ventricular fibrillation, ventricular tachycardia, it causes the instant death in these patients. And the management of this heart attack is costly. It is a very costly, and cost is one of the reason in India where the patients were not getting the optimal treatment of the patients of heart attack. So how to keep this, and that's why it is the prevention is always better than the treatment. So these are the few tips to keep your heart healthy. Take a healthy diet, take a balanced diet including fruits, fresh vegetables, leafy vegetables, avoid fat and the oily foods. Do exercise daily around 30 to 45 minutes daily, minimum 4 to 5 days in a week, and do the heart friendly exercise like jogging, swimming, and cycling. Maintain the lifestyle modification, do the lifestyle modification and the stress management. Maintain the work-life balance. Stop smoking. Do the regular checkup for the risk factors and do the screening for the coronary artery disease. And if you have some problem with the risk factors like hypertension, diabetes, or the heart problem, take a medication regularly as per advice by the doctors. Thank you very much.